Closing the Gaps, Prosper's Role in Advancing Maternal Health and Mental Health, presented by Bridget Mullen and Sarah Collins. Hello, my name is Bridget Mullen, and I am a member of the Colorado Prosper Health Access Team. I am a licensed psychologist in the state of Colorado and an assistant professor at the University of Colorado Anschutz in the Department of Psychiatry. I have worked to support perinatal and infant mental health over the past 5 years with a focused interest in populations at greater risk for their health outcomes being impacted by the social drivers of health. As a member of the Colorado Health Access Team, I am excited to share more about the strategies Colorado Prosper is using to reduce perinatal mental health care gaps.
Hi, my name is Sarah Collins, and I am the Resource and Referral Specialist for Colorado Prosper. I'm usually the first point of contact when a provider reaches out to Prosper. When you call, I'm the person who answers, helping gather the essentials, understand your patient's needs, and connect you to the right next step.
At Prosper, we are deeply committed to advancing access in mental health and substance use services for perinatal populations. Our efforts focus on addressing and reducing the disparities linked to maternal mortality by improving access in rural areas and among historically marginalized communities. We strive to ensure that all individuals can connect with timely, appropriate, and culturally responsive care.
Prosper is Colorado's free, payer-blind perinatal mental health and substance use access program. We support providers statewide through real-time psychiatric consultation, personalized resource and referral assistance, and training, helping ensure patients receive timely, person-centered care. Prosper was created to close the gaps in perinatal mental health and substance use care, and resource navigation is one of the most significant barriers facing both patients and providers. Our resource and referral support directly addresses this challenge by offering individualized, thoroughly vetted connections that align with each patient's clinical needs, insurance, preferences, and circumstances. This work reduces delays, prevents dead ends, and helps families access right care at the right time.
Prosper works alongside frontline providers to strengthen mental health and substance use care within trusted patient relationships, while also increasing access to high-quality mental health, peer support, and other community resources. Together, we help reduce disparities that contribute to maternal mortality by removing barriers and connecting families to person-centered resources that fit their needs.
As the Resource and Referral Specialist, I will help facilitate referrals to group, individual, or dyadic therapy, psychiatrists, and more. When identifying resources, we consider insurance, but also the complexity and acuity of the patient's mental health or substance use needs, cultural and linguistic preferences, and specific identities that might make particular programs more affirming or relevant. A couple of examples of what Prosper can connect families to include the Connections Program for high-risk infants and families, the Recovery Coach Doula Program, or resources with services tailored for a specific clinical concern or cultural group. If your patient is in rural Colorado or deep in the mountain towns, Colorado Prosper is here to help you find the right resource. Finding mental health care is one of the hardest parts of the perinatal experience. Long wait lists, unclear eligibility, closed practices, and confusing insurance rules. To ensure the quality and appropriateness of mental health and community resources shared through Colorado Prosper, we follow a structured vetting process. This process takes that burden off providers and patients as every referral is individualized. Resources are identified through provider recommendations during the consultation call, established community partnerships, and research based on patient needs. I personally call each resource to verify openings, confirm insurance, clarify requirements, and ensure the resource is right for the patient, all before they are sent back to the calling provider. We track and update details in our resource database regularly based on provider and patient feedback. When appropriate, I will follow up with the patient 2 weeks later to make sure that the resource actually connected for them. This high-touch process means providers can trust that what we send is accurate, up-to-date, and tailored, resulting in patients less likely to hit a dead end.
Building on the information that we've shared here, the next video will focus on connecting mothers with peer support and other community resources that reflect their cultural and geographic identities. Dr. Antonella Onofrieta will share how peer support reduces isolation, strengthens engagement in care, and improves maternal mental health, and how you can use these strategies in your practice.